Hi everyone, my name is Jaspreet, your Director of Clinical Services. I'd like to welcome you all to the recorded training session for Skilled Nurse Visit Note. As you all may have noticed that Devero has changed our Skilled Nurse Visit Note. I'd like to walk you through your Skilled Nurse Visit Note on how to complete it. And if you have any questions after this recorded training session, you do not understand any of the fields, how to complete it, or anything in your Skilled Nurse Visit Note, please feel free to call our office. You can reach me at 510-745-7878, or you can also reach Zelda, who is my backup in case I am not in office. So we'll go ahead and get started real quick. I am in my test environment. As you can notice, I am on my test patient. I'm going to go ahead and open a Skilled Nurse Visit Note, as you all would in your real patient environment. I am going to select today's date or the date you're making the visit. I'm going to select, for example, today's date. I'm creating my note. On the left upper hand corner, you will notice there's two pages to your Skilled Nurse Visit Note. There's page 1 and page 2. On the right hand side, we will go ahead and enter today's date, the date of your visit. You will enter the time. I'm going to go ahead and put in 8 o'clock. I'm going to put in 8 a.m. and then time out. I'm going to end my shift at 2 p.m. There we go. Make sure the time in and out is the actual time you are starting with the patient, and then the out time, your time out would be the time you are leaving the patient's home. On the very top, you see this gray section. It's already pre-filled. This comes from the patient profile, so you have nothing to do here. But down here, you see medication changes since the last visit. As an LVN or an RN, you need to receive new orders from the physician. Those orders received, you need to input those orders in med profile. Every time you get a new order, let's say it's a telephone order or the family goes to the patient's home and brings new orders on the visit note from the physician's office, you need to input those orders in your med profile. So this is basically asking you medication changes since last visit. If there were no changes, you would say no. If there are changes, you would say yes, and then you would update the medication profile. If you don't know how to enter medications in your medication profile, please ask your case managers to assist you with that. If not, then you can also call our office. All the blue sections that you see need to be filled out, and they're the same sections that used to be previously in our Skilled Nurse Visit Note. The very first section is your vital signs. This is where you input all your vital signs for the patient, and here you will put your blood sugar for the patient. And then under additional vital sign details, under blood sugar section, you will notice that it does not show if who gave you the blood sugar reading, where did it come from. So that could go into additional vital sign details. And also if there's any abnormal findings with your patient, you can enter in your additional vital sign details if it pertains to the vital sign section. Your next section is for pain. This is where you'll document, is the patient having pain during your visit? How severe is the pain? Where is the pain located? Did you give any pain medication to the patient? And how frequently is the pain occurring, and what impacts the pain? So please document that here in this section. Your cardiovascular is your next section. This is where you would check if patient has any abnormal findings. If you don't find anything abnormal with your patient, please put on no deficits. But otherwise, you should be listening to the patient's lung sounds, heartbeat. You should be listening to the patient's heart rate using your stethoscope. If you don't find any changes in your cardiovascular system, let's say any new changes, then you would say no deficits. But let's say patient has edema. I'm going to go ahead and enter my patient has pitting edema. And I'm going to enter 3+ at the right lower extremity. Are you checking for pedal pulses? You should, because we need to make sure a patient has pulses in their lower extremity. So I'm gonna go ahead and document that. If there is right, is it strong, is it weak? I'm gonna go ahead and put strong pulse, and then left, maybe I can just enter weak pulse. And comments you would put here if there's anything significant that you need to document based on the cardiovascular system. And if the patient complained of chest pain, let's say you should say at 2 p.m. patient complained of chest pain, nitroglycerin, sublingual provided, given under the tongue ×1. Usually you can give it up to 3 times maximum, and then patient denies any further chest pain after 5 minutes. Then respiratory, you would document if patients having cough. This is the season, usually patients have a lot of cough. So you would go ahead and document here cough. If it's dry or productive, I would say productive. Then I'm going to put the sputum color, yellowish, yellow, thick mucus, yellow, thick color mucus. If the patient's on oxygen, I will put patient is on 3 liters per minute via nasal cannula, and I can put it as continuous. And then you would document here anything else that's related to the respiratory system. Neurological, is the patient alert and oriented? What is the patient alert and oriented to? Person, place, time. If the patient is confused, then you would document here. If the patient's forgetful, if the patient has seizures, you would click here under seizures, and then under comment section you can add when the seizure occurred, how long did it last, was the patient assessed after the seizure, and were there any abnormal findings after the seizure, and that you have informed the physician's office. Here you can also document if there's any change in mood for the patient, if the patient has hearing or speech impairment. Integumentary system, you would document color normal for patient, or if the patient looks pale or ashy or jaundice, whatever the findings are. Skin turgor, I would say patient's fair, temperature warm. If there's any wound present, you would click here and then fill out these sections for the wound. There's 2 sections for the wound noted here. Let's say patient has a wound on left foot. I'd say it's a skin tear. It occurred from patient bumping into something or got a cut. And then stage, you would skip that completely because you would only stage pressure ulcers and nothing else. You will skip length, depth, width, or any tunneling. No dimension should be written by LVNs. RNs are, it is within the scope of practice to write, to measure the wounds. So you can, if you're an RN, please go ahead and measure the wounds. If you're not an RN, then please skip this section. You would document how the surrounding skin looks like, if it's red, pale, black, purple, edematous, or normal. I'm going to document it's normal. If there's any drainage, I'd say there's no drainage, but if you notice drainage on your patient's wound, you would document that. How much is the drainage? For this example, it'll be none, but if your patient has drainage, you need to document if it's scant, small, moderate, or large. If there's any odor, let's say pungent odor, or if there is no odor, then you would skip this section, or you can say none. Wound bed, what does it look like? Bloody, pale, sloughing, necrotic, eschar, granular, weeping, or healthy? I'm going to document it looks healthy. Then you would also document under wound 2 if patient has a second wound, and the care provided, you would say cleanse with normal saline, packed with, I'm not packing it because it's a skin tear, dressed with gauze, covered with tape. And then you could also document what else your findings are here. Your second wound would go here. And any additional integumentary finding, let's say patient unexpectedly had a wound in the groin area or a boil in the groin area, and this is the first time you're noticing it, please document here, and do document that you've informed the case manager of this boil. Here is pressure relieving devices. This section here is the patient on any special mattress. You could put air mattress or pressure relieving mattress. Okay. Oh, one section I forgot to mention is make sure every time you do a skilled nurse visit note, your patient needs to sign your note, or whoever their representative is. If it's a minor, then it would be a parent. If the patient's cognitively impaired or can't sign, then you would, if there's a family member present in the home, you would ask for a signature. I would save this page. It's going to take you over to the next page. Next page contains GI system. Did the patient have a bowel movement? I would say yes, patient had a bowel movement. Whoops, pardon me. Today, bowel sounds present. And are there any described deficit bowel sounds, if there are any, or if you notice anything? Diarrhea, does the patient have diarrhea today? Is the patient incontinent? Is the patient constipated? Abdominal girth, you would only measure if it is in the plan of care. If it is not, you can skip this section. Or let's say if patient has history of ascites and plan of care says measure the abdominal girth every month, then you should be measuring it on a monthly basis. Otherwise, you can skip this section. If the patient has an ostomy, what kind of, is it a ileostomy, colostomy, what kind of stoma, what does it look like? So these are some of the things you could document in this section. The other important thing I want to go over is your blood glucose. You can write down what your patient's range is for blood glucose and who performs the blood glucose monitoring, and were there any hypo or hypoglycemic symptoms noted? And you should always be checking the patient's foot. For any patient who has diabetes, the feet is the most important thing you should be looking at. If there's any break in the skin, or if the patient's been injured and has no idea about it. Some patients don't even know that they have a wound if they're diabetics. So please document that here. Foot changes, foot check performed, no skin breakdown noted. Noted. Okay. Your additional comments would go down here. Musculoskeletal. Have you noticed any abnormal gait? Limited range of motion. Which side is limited range of motion? Was there any issues with balance, limited mobility? Is the patient using an assistive device, let's say wheelchair or a cane or a walker, whatever the patient's going to use, you need to document for ambulation. Is there any paralysis or contractures? If the patient has contractures, then down here in the comment section, you would document further what is it that the patient has that's new and that's ongoing, and that you're caring for. Infusion section you would skip. Genitourinary is what you would also fill out, voiding without problems, no issues with incontinence. Otherwise, you would, if patient has a catheter, let's say patient has suprapubic catheter, then who is helping with the catheterization? Then when was the last time catheter was changed or straight cath was performed? You need to document those findings under this section. Supplies used, what kind of supplies were used to perform the care? You could say gloves. If you've done any kind of dressing changes, you would document that. And then here comes the homebound status. You can skip this section altogether, the homebound status section right here where it says eligibility and comments. All the grayed out sections you need to skip until and unless we inform you that you need to start documenting, and I will provide you with a new video training on how to fill those fields. Right now Devero has not kicked in completely with the new changes, so you will see this section as empty, and please do not click on interventions or eligibility to enter anything in. scan. It should automatically be populated from the plan of care that the case manager creates. So skip this section. Under interventions provided, this is where you will enter your shift nursing notes that you create on a regular basis, that you always enter your hourly documentation, what's going on in the patient's home, what are you providing for the patient, what medications are you're giving, any changes that's occurring with the patient on an hourly basis or every 2 hours. You need to document that under interventions provided. Education would be, what kind of education have you provided to the patient? Let's say patient has low blood sugar levels, so you will educate them on that. If the patient is starting to have some redness on the skin, then you need to educate the patient to reposition the client, or you need to educate the family to reposition the client every 2 hours. Your response to the interventions: how did the patient or the caregiver accept your training? Did they verbalize understanding? Were they resistant to the training, or were they agreeable? You need to document those findings. So in this intervention education provided section, you will just fill out these 3 fields. Supervision section, please skip that. It is for the case managers, so you don't need to document here anything. Your goals, you would skip the gray section. And then ongoing skill need, if you're performing, let's say, blood sugar checks on a everyday basis, you can document that. Patient requires daily blood sugar checks with insulin administration, or another example would be G-tube feedings. You need to go in every day and provide G-tube feeding. Or shift nursing, what kind of skill need, ongoing skill need does the patient require? Under care planning or coordination, if you are calling a physician's office, let's say for new orders, and then you also inform the case manager of those new orders, please go ahead and document here care coordinator with. You would document, you would click case manager and physician, or if you spoke to another person, let's say clinical manager, you called me, for example, to inform me of the patient's current status, then you would click here, and then coordination details would go here. Informed the physician of the new boil, new order received from the physician. And then you could also document that you informed your case manager and the director of clinical services. And whatever the conversation occurred, you could document here. Discharge planning, please skip that section. You do not need to enter anything for discharge planning. For your plan for next visit, you could click here, assessment. You could document next visit to be made, let's say it's tomorrow, 0203-2018 for G-tube feeding. Feeding or blood sugar check. Teaching would be, what are you teaching the client today? So you would go over, let's say, educated patient on signs and symptoms of hypo/hyperglycemia and elevate lower extremities. Treatments of therapy or procedures that were performed and preparation for discharge, you would skip this section. You could enter treatments and procedure or therapy. You could say wound care or diabetic visit, check blood sugar. Okay. Date of next physician visit would be you find out that the patient has a visit with the physician for that boil checkup, or for let's say the foot, if there's a skin tear next week, then you would click when is the next visit, and you would check the name of the physician. Usually it should appear based on whoever the patient is on the profile. For that patient, it should automatically populate. If it does not, you can click here and select the physician's name. Once you are completed, you need to send this note to our office. So you would click the button send to office. And if you haven't finished your note yet, you feel like you still need to go back and document further, you just save it and come back to your note anytime. Once you have completed your note, which should be completed within 24 to 48 hours of your visit, you would go ahead and click send to office, complete with signature. I'm gonna go ahead, enter my username and password. I will authorize it. And now let's go to the test patient chart, and we can see here is my note that I have just completed. This is how you complete your current skilled nurse visit note. If you have any questions, please give us a call, and when there are more changes to your skilled nurse visit note, I will definitely create another video so I can go over how to complete that. And there'll be another upcoming video soon on how to complete physician's orders for any new orders, such as wound care dressing orders, dressing change orders, or for any medication orders. Please do not hesitate to call our office. We are here to help you. You are not alone. I know these changes could be overwhelming, so feel free to call our office. If I'm not in office, please reach out to Zelda. Again, thank you for attending my training, and I hope this was helpful. Please give us your feedback if this video has been helpful. Take care, and look out for another video upcoming soon. Thank you. Bye-bye.